Happy Friday afternoon, everybody. Mayor Alan Weber here from the mayor's office with my good friend, Dr. Wendy Johnson, who is in her office uh, at La Familia, checking in on COVID, COVID related issues, what's going on with vaccinations. Dr. Johnson, let's just turn it over to you and give us a quick state of the COVID world. What's going on? How are we doing? Where do we have concerns? And how do we come through this thing? We're not done yet. How do we come through it even stronger?
Yeah, well, I think we're not done yet, but I think we're definitely very sick of it. I was out on the plaza on Juneteenth, and that was just a lovely community celebration, and I think there was a sense in the crowd of catharsis and coming together, and really nice that we have that space that we can do that outside in a relatively safe manner. That was lovely, and I know people are sick of it. I'm sick of it. But we do have, and I'll say shout out to Santa Fe in general. We're almost at 70% of our population with 2 vaccines. We're probably over that when you consider all the people that went to Texas that aren't counted in those numbers. So let's just say we're at 70% in our community of folks that have both vaccines. And, that's well on our way to herd immunity for our community. But as anyone who goes downtown or really anywhere in Santa Fe knows, it seems like almost the majority of license plates are not New Mexico license plates this time of year. So we have a lot of people coming in from states that aren't vaccinated. And, although we might feel, okay, I'm vaccinated, you guys from Texas and Arizona can do whatever you want. But there's some number of us who are vaccinated who still won't be protected. Remember, the vaccines are only 95, not 100% effective, even the most effective ones, Johnson & Johnson, even less than that. So, to protect our own community, especially our most vulnerable, and also kids under 12 who can't get vaccinated yet, we just have to be vigilant and watch those case numbers. That's what I do every single day. I look at those case numbers when they come out, and I want to see them go down. I want to see some days where we have 0 cases in Santa Fe. I want to see them consistently down below 5, just a sporadic case here and there popping up. And then I'll be able to breathe a little bit easier. But then the thing that's kind of out there ominous in the clouds is the Delta variant, right? Which is, although the Pfizer vaccine is pretty effective, it's less effective. One shot is far less effective against the Delta variant, only 30% effective. And it's more contagious, and it's probably causes more serious disease. And so I'm especially concerned as we all start traveling again. I know a lot of folks are planning vacations out of state, overseas, as we're going to places where there's less vaccinated people, fewer vaccinated people. And as they're coming here, even Europe has a much lower rate of vaccination than the United States. And as we're going, as people are all traveling, remember, that's how this whole thing got started. So people traveling quickly, it kind of exploded. And we can see that again, as long as we don't have that herd immunity in all the places that people are coming from and going to. So I think we just need to be aware that I know this is super unpopular. I know you as mayor are hyper aware of this, but it's possible that we might in the fall have to go back to some precautions, maybe not the full level, because we are almost a fully vaccinated population here, but thinking about wearing masks again, especially indoors, thinking about social distancing, especially indoors, and that kind of thing. It's possible we might have to go back to that in the fall. So I just try, as much as I'm sick of it, everyone's sick of it, and we just want it to be done. It's not quite done, and we just have to be vigilant and watch what's going on and be prepared to respond to whatever the eventuality is.
Yeah, you're spot on as usual. I think a couple things. I do have some data of our caseload in Santa Fe County. Yesterday was 10 new cases.
Right.
The day before that was 3. The day before that was 4. Then the weekend, a 3-day average of about 4. And then, so we're hovering around there, but we do have these spikes. And from what I'm hearing, it's younger people, and it's it is sometimes the Delta variant that's in New Mexico. So, and the other thing is, it's people who are not vaccinated. Let's be
Right.
honest. There was a national news story today that said almost entirely the deaths that are now occurring because of COVID are happening to people who are not vaccinated.
Right.
And some people can't get vaccinated. I understand you have an underlying condition, something prevents it, but the efficacy, the safety of this vaccine is tremendously well proven. So we have vaccines, we have people who'll deliver them virtually to your doorstep, to your workplace. Get vaccinated. Let's get from 70% to 80%. Why not? Why stop at 70%? And
Right.
then, and then as we reopen, and there is some great news about what reopening is meaning to our community. It's not just the Juneteenth celebration or tomorrow's Pride parade. It's restaurants and hotels and other music venues. It's movie theaters, bowling alleys. It's family barbecues. It's the 4th of July. We're going to have a 4th of July show over at the Santa Fe Place Mall that's going to be spectacular. But it's predicated on people being safe around each other because they're vaccinated.
Right.
And you're right. I still carry my face mask with me. I'm very conscious there are people who feel more safe. You do too. Yeah.
Right here.
It's good. There's
Yeah.
nothing wrong with that. And we'll be hitting a flu season coming up, as you say, in the fall, whether it's COVID or just, flu. Wearing masks is a good safety precaution then as well. So get vaccinated. It's the best solution. But if you can't do it, then do wear a mask and stay safe, because we don't want any more cases. We don't want young people in particular ending up in the hospital with a variant and then spreading it as we get back together again. What about I want to ask you about something that's really foremost on my mind, because we had a couple tragic police shootings this weekend, or this week heading into the weekend. And I'm not licensed to practice as a psychologist or a psychiatrist, but my sense of how the world works, and President Biden spoke to this, is we're seeing a spike in homicides and gun-related violence around the country. And it's not just in Santa Fe, it's in cities large and small, where people seem to be coming out of COVID and having serious mental health issues, behavioral health issues, depression, anger, and some of it is being acted out in public spaces with weapons. And I'm very concerned about the post-COVID mental health crisis that we may be facing.
Yeah. I mean, I think a couple of things are going on. One, a lot of people had a great sense of isolation during the whole pandemic, couldn't see friends and family as they normally did. Also, a lot of people lost their jobs. And although we had pretty good, programs to help people, for a lot of folks, it wasn't 100%, and so now they may be in debt. We're facing the eviction deadline now. A lot of people may get evicted, and probably a lot of anxiety around that. The unemployment benefits are ending. Still, a lot of people don't have jobs. People might be facing eviction. So it's all this kind of pent up and deferred need of issues and anxieties that now are kind of coming to fruition. We see it also in the medical care field, where people were not coming into the doctor, even people with chronic diseases like diabetes or hypertension, and because they were afraid. Or even pregnant women were deferring going to prenatal care until later in their pregnancies because they didn't want to go into a clinic where they might be exposed to COVID. Or even though we were very safe here, there was misconceptions about that. And so people were afraid to go out in public. And so now there's a lot of deferred healthcare needs. People are just feeling worse because they haven't attended to their healthcare needs. I know I just called and made an appointment with my dentist, which is a minor thing, but I think it's been about 2 years, since I've seen the dentist. Before the pandemic, I know, and then I didn't go the whole time of the pandemic. So, that's a minor thing, but we got a lot of people with a lot of major issues, maybe people doing therapy that were doing therapy one-on-one, and then they did it over the phone, which, it has some positives, but there's something about that personal relationship interaction that's lost. And I think a lot of people just it increased the sense of isolation, all of that together. And now all the anxieties about reopening, not having a job, being in debt, maybe, all the different situations people are in are just blossoming. And then I just want to mention healthcare workers, essential workers. For me anyway, and for a lot of my colleagues I know, it's been kind of like a marathon. It's been like, okay, I just have to make it another mile or another half mile, or I just have to make it. And every time we said that, it was another month or two, it was more. It's kind of like when you're in a hike and you're on that steep incline and you say, okay, I can see where the incline stops. If I can just get to that next tree, and then you get to the tree and then there's like another, you see that, oh, there's another hill behind this hill, and how demoralizing that is, sometimes. So that's how we felt. A lot of healthcare workers and other essential workers, grocery store workers, other kinds of essential workers, mental health workers, certainly. And now we're starting to see really things opening up, and it feels kind of normal. But we're dealing with such a crush of deferred needs, both in behavioral health and medical care. We want to take a breather, and it's almost like we can't take a breather now, And so I think all that together is going to take a while to sort through, and it's going to be really compassionate, employers. It's all of us, a lot of patience from all of us.
And also there are resources. I mean, we shouldn't ignore the fact that people need help, and there's help out there. If you or your family or yourself or someone someone you work with is exhibiting signs of real depression or demoralization or a feeling of being lost, they don't feel like they're themselves. We don't want to see people suffering like that. We can help people. There are resources. There are help phone numbers. As you say, you can still do mental health over the phone. You can ask for help from one of our mental health services, NAMI, here in town. And it is absolutely the right thing to do. If you take the notion that the global pandemic that was COVID required all of us to do things that brought out the best in ourselves and in our families and in our friends, that we realize that it's important to look after each other. And if it meant wearing a mask, wear a mask. If it meant staying home and you could, stay home. Everybody did what was required, and there was no sense of shame or embarrassment or stigma to doing the right thing when we were trying to tackle COVID's early onset. Well, now we're coming out of COVID and we're into an early onset of mental and behavioral health related crises. And there's no shame or stigma around getting help for that crisis. It's COVID by another name. And so asking for help, calling up, looking for a mental health provider, referring a friend, intervening and saying, you really don't seem like your old self. How can I help you? Let me get you some help, is the same thing you'd do if you said, you know what, if you've lost your sense of smell, maybe you have COVID, let's get you some help. It's exactly the same situation, but we don't talk about it because it's mental health or behavioral health. And we've all got to stay with it as we come through COVID. You're right, there was a false summit that if we could just get through COVID, we'd be at the top of the mountain and we could see the future. Well, we're at the top of the mountain, and guess what? There's another mountain. And we've got to climb that mountain together too.
Yeah.
And we have resources to help us. Nobody's in it alone.
Yeah, there's a lot of mutual aid organizations that are just informal in Santa Fe. In terms of mental health, a really good first stop that can refer you to other places and help you if you're in a crisis is the New Mexico Crisis Line. And that's 1-855-NM-CRISIS, 1-855-662-7474. Easy to Google and look up. You'll find it right away. So, that's a good first stop. If you have a primary care provider, talk to them. A lot of referral sources in town as well. We're pretty blessed in that way in Santa Fe in terms of, a lot of rural places, it's pretty hard, but in Santa Fe, we do have pretty good behavioral health resources here.
And I think I really predict, and I think it will happen, that There will be both a statewide call from the governor and her team, because this is her wheelhouse. She understands public health. And I think the federal government's going to have to step up and say, coming out of COVID, we are not back to the way it used to be. We're seeing the pebble got thrown into the pond and the ripples are starting to play out. And yes, we have a lot of pain from COVID. We lost friends and family. We're coming through that, but there's an aftermath that we have to deal with, the ripple effects that we have to deal with. I think the federal government will end up stepping up as well and making more resources available. But I think as a public health person, you understand this better than most, that it's just another dimension to how we have to attend to our public health. It's COVID by another name. It's not any different in terms of its importance.
Yeah, absolutely. And I think another thing that we have to talk about is the grief. You know, a lot of people lost family members. A lot of people now have the chronic disease of the long form COVID and are dealing with that. So, you know, a lot of it's directly COVID related, but you're right. It's the ripple effects as well. And so sorting through all of that, I mean, you know, Santa Fe is a great place. I mean, lots of folks said this. I think it was said at the bandstand. On Juneteenth. It was a great place. If I had to go through a pandemic, there's nowhere I'd rather do it than Santa Fe. And I think it's a great place for the recovery too, because I'm a little bit concerned with all these newcomers, not that I'm anti-newcomer, but I just want, rather than them coming in and wanting to change our culture, we need to show them the Santa Fe way of caring for your neighbors, of that kind of spontaneous sense of community that we have in Santa Fe. And as long as we can keep that with the influx of all these newcomers and really teach the new folks that, I think we're going to be okay. And I think we'll take care of each other. I think that's a very special thing about Santa Fe.
Yeah, it's been Santa Fe's calling card forever. It's diversity, but it's also unity. And we're able to do both. Well, all right. Thank you, Dr. Johnson. I understand you're on your own vacation coming up, so have a great time.
Maybe I'll see you in a couple of weeks. We'll see. All right.
Stay safe. Have a good trip, and we'll see you when you get back.
All right. Bye-bye.
Thank you. So from Dr. Johnson's lips, she's absolutely right on. This is a special place, and there's a lot of things to be grateful for. We are grateful for our community and our unity and our friendships and our diversity and our celebrations. The Juneteenth celebration, there's a pride parade coming up tomorrow. It's around 11:30 from the PERA building. There'll be music on the plaza. There'll be people dancing and having a great time. So please step up and take part in that. We just heard this week that the Fuego were awarded the All-Star game this year. So July 11th, we'll be hosting the Pecos League All-Star game, another celebration of baseball in Santa Fe. There'll be a big fireworks show on the 4th of July down at the Santa Fe Place Mall. Don't do fireworks at home. Don't do fireworks on your own. We're in a drought situation, but we have to take care of our own safety while enjoying the celebration of democracy and the 4th of July. A big show. Ray Sandoval and his team from the Kiwanis are putting on a bigger than ever show. They got some fireworks with a limited shelf life, so they'll be shooting them off this 4th of July. It should be safe. It should be fun. Come and celebrate at the Santa Fe Place Mall. Thanks to the Santa Fe Place Mall folks for making the space available. And our economic recovery is quite remarkable. We got our April gross receipts tax numbers. They are substantial. It's about the third best in history. There were a tremendous rebound, not only from big stores and big operations like hotels and restaurants, but mom and pop shops, retailers, small, long-standing Santa Fe businesses are recovering and rebounding with strong economic performances. And we haven't even hit Indian market, Spanish market, folk art market, the opera, the Lensic, music on the plaza. If we can stay cool and stay together and stay safe, this is going to be a summer celebration to remember. We'll be celebrating making it through COVID, vaccinations that kept us all safe, thanking our frontline service workers, the people in the hospitals, nurses, doctors, emergency room people, police, fire, EMTs, and also grocery store workers, teachers, pharmacy workers, people who were keeping us going, our nonprofits, the Food Depot, all the people who fed people who needed help. I mean, we look back over COVID, 16 months or so, this city performed remarkably, absolutely remarkably. There are too many people to thank as we think about making it through, coming through this pandemic. As Dr. Johnson said, there's no place any of us would rather be than in Santa Fe when we have to stay home, look after each other, embrace each other, help each other, have that deep sense of community. That's Santa Fe in a nutshell. I want to touch on the events of this past week. We had great news in our economic rebound. We've got great coming attractions. Things are going to happen that are going to be fun and entertaining, joyous celebrations. And we also had two police-involved shootings, one involving the Santa Fe Police Department, one involving the Santa Fe County Sheriff's Office. In both cases, the suspects who were involved were shot and killed. It's something we're not really used to seeing here in Santa Fe. We're glad we don't see it often, but we're also very grateful to our public safety and law enforcement personnel when they keep us safe, when they do run toward danger rather than away from it, when they step up on behalf of all the rest of us to put their own lives on the line. There'll be, in both cases, investigations by the state police who take over and do the interviews and the data collection to find out what happened and to assess those incidents. But in the meantime, I think it's important to say we are very grateful to all of our public safety and public health people for looking after us and keeping us safe. These can be very hard times. We know that people are coming out of COVID, and frankly, some people are emotionally disturbed by the return to coming out of hibernation. They're dealing with issues of mental and behavioral health. They're dealing perhaps with other stresses in their lives that push them to take on or undertake activities that put them on the wrong side of the law. We need to beef up our public health and safety support systems. We're reaching out to try to hire more police officers. We're going to use technology to secure spaces and places that we know are often where crimes may take place. We're going to use smart approaches to trees and bushes and areas where trimming things back change the environment so it's less likely that crime can take place there. We can use technology and have more eyes on the street and keep people safe that way. And we will do everything we can to thank and reward and support our public safety personnel, police, fire, sheriff, emergency response teams. These are the people who are there for us every single day. They look after us, and they are the ones who put their lives in danger to keep our lives from danger. So it's troubling. It's a national phenomenon. We're going to step up and do our best to respond with smart strategies and intervention. We do have the alternative response unit team that goes out now to interact with people who are having bad days or who are dealing with mental health issues or who are homeless. We want to give them social services to help them through their bad days. We're reaching out more and more with the county, cooperating to try to offer better solutions to keep people out of harm's way. That really is a serious issue around the country, and I think it's a serious issue around the state. And I hope to take it up with our state level officials, the governor and her team, as well as the county, so we can partner effectively to keep everybody safe and secure in Santa Fe. That's about it for a Friday afternoon. It's beautiful in our community and in our city. The weather is cooled off a little bit. We may get some cooling rain, which would be a blessing. But we also have beautiful skies and lovely trails, and the parks are looking good. Our teams are out doing maintenance and upkeep. Folks are working very hard to beautify Santa Fe, keep it beautiful, keep the mediums looking good, filling potholes, getting our city back into shape as we come out of a very hard 16 months of COVID-related shutdown. Until I see you next week, please enjoy this weekend. Have fun with your family. Come out to the Pride Parade and cheer and dance. Come out and bring your family. Come out and have fun. Let's return joy and celebration to the beautiful streets of Santa Fe. So until I see you next week, please remember to take care of yourself, take care of your family, take care of the community, and then together, all of us together will take care of the city we love, the city of Santa Fe. Take care, everybody. I'll see you next week. Bye for now.